Welcome to Utano Podcast. Let's talk about health in Africa, where we explore innovations and policies that are shaping healthcare across the African continent. I am Lenias Hwenda, coming to you from Johannesburg during the G20 summit. Today, we are joined by Dr. Harvey Allchurch, the head of international affairs at the European Medicines Agency in Amsterdam. We'll be talking about how the EU Medicines for All initiative is transforming access to medicines on the African continent and what it means for the approval of innovative therapies and regulatory collaboration between Europe and Africa. Harvey, welcome to Utano Podcast.
Thank you very much.
Let's start with the big picture, Harvey. For listeners who may not be familiar with your work, can you explain what the EU Medicines for All is and why it's important for accelerating access to medicines in countries outside of the European Union?
I'll try and do it in a simplified way. Within the European Union, we have what we consider to be very high standards in terms of the regulatory approval process, the transparency of the process, the robustness of the process, and the standards by which we do these assessments that then lead to marketing approval in the European Union. The EUM for All is all of that I just described, except for the marketing approval in the European Union. So we use the same, it is designed explicitly to assess medicines for use outside of the European Union, together with the WHO, and often with assessors and expertise coming from countries where the products will be used. And they're designed to look at the benefits and the risks of those medicines in the context of where the medicines will be used. So it's designed around getting medicines to places outside of the European Union, and we hope improves equitable access and speed the solutions for public health.
That's a powerful combination, combining speed, science, and solidarity, and helping novel therapies to reach patients outside of Europe faster, whilst preserving and maintaining safety. That's really great. And I think our listeners will immediately see how that matters for everyday lives across the African continent. Now, turning to specific innovative products, the most recent one everyone is talking about is, of course, lenacapavir for HIV prevention, which has been described as a game changer for HIV prevention. Can you unpack why this product is particularly significant and whether there's a particular target product profile that makes a product most suited for the EU Medicines for All pathway?
I'll try to answer that in two different ways, but let's focus on lenacapavir and why it's potentially a game changer. I think if there's had to look at one element, it's patient compliance. I think this was one of the big things that we focused on. I think there are data, and I think it's been published in the Lancet that talks about that. Less than 30% of people who start using daily oral PrEP actually maintain the protective effects after 6 months because they stop taking it. And so by having the poor adherence, all the things that we know about daily use, that's all goes with this 6-monthly PrEP treatment with lenacapavir. So. And that's part of the answer to addressing what we're seeing as the reemergence of HIV infections in some areas of the world. There are other elements about what makes a product particularly suitable, and I think here there was some really good data. So we had really good clinical data, we had really good safety data, and I think all of that combined. And we'll talk about it perhaps a little bit later on, but I don't want to unpack it too much here, that we knew a lot about the products at the beginning. The company had engaged with us early, they'd engaged with the WHO early, and they had engaged with some of the regulators in the countries where it was going to be used early. So all of that was like a perfect combination. And that's what made it that's what made it so successful as a process. And we're already seeing just days, weeks after our opinion, South Africa
Mm,
has already approved, and more recently, Zambia and Zimbabwe have already approved in amazing record times. And so
mm.
this is what gets me excited actually about the whole thing, because we're seeing these products being approved. We're already seeing shipments and availability of the products in southern parts of Africa, and this is what it's all about. We're seeing patient access.
It is exciting indeed to see science translating into such practical, life-changing solutions immediately and at such speed, facilitated by this collaboration that you have at the European Medicines Agency. Now, how do you see this innovative product, this collaboration shaping HIV prevention in countries with limited healthcare infrastructure?
I think that's a complicated question because
Mm,
as regulators, we have but they used to be called, they had a gatekeeper role. We were
mm,
the gatekeepers to prevent medicines getting, bad medicines from getting in. I think I
mm,
see particularly the EUM for all as a facilitator role. So, but we facilitate the development of medicine, so we can be involved in the clinical trials development,
mm.
the advice about how you set up the whole clinical package. So we
Yes,
can do all of this regulatory and the science bits together with product development partnerships and companies. But then there's a health value chain, and after the
yes,
regulatory decision, it's all about how do the has has the primary healthcare system got its ducks in a row, to use a
mm,
terrible British expression?
yes,
Are there the therapeutic guidelines?
mm,
Is the primary healthcare system set up? Is there funding for the treatment and for all the follow-up, particularly in HIV? So
mm,
there is a whole value chain, and that comes back a little bit to what I mentioned about lenacapavir, that the company had engaged early with
mm,
the countries where the product will be used, and they'd engaged early with WHO. And that's particularly important in a
mm,
broader sense, because one of the advantages of us being able to work with WHO on this is that it's not just on the pre-qualification regulatory approval side,
mm,
but we also try to make sure that the programmatic side also works. And so that if WHO needs to update the treatment guidelines or to
mm.
update other parts of the particular therapeutic program, they can do that in time. So it's
Yes,
companies, product development partnerships, they need to think about it early and plan rationally
mm,
from upstream to downstream,
yes.
because it's about patient access. And if we don't prepare the patient access bit, we can have the most perfectly designed assessment process. If it doesn't get to the patients, it's for nothing.
Absolutely. And countries, of course, have a big role to play in facilitating that value chain gets that product into the hands of patients. So that's quite important. Now, when the EMA evaluates breakthrough products like lenacapavir under the EU Medicines for All framework, how do you balance speed with safety?
I think it's a question we often get asked, and it makes it seem as if it's a binary. It's either fast or it's safe. And I'm going to push back slightly in that question, because I don't think I think it sets us up for the wrong discussion.
Mm,
The reason we were able to um, review lenacapavir in an accelerated assessment is because we had prior knowledge. Because in this particular instance, the company had come to us early in the development phase. So we knew the product, we knew the development pathway, we had a lot of prior knowledge. And so when it came to actually doing the assessment for lenacapavir prep, we weren't starting from scratch. We were starting from a position of knowledge, a position where we already had good engagement and a good understanding. And so we were able to accelerate the assessment. And this is why we were able to do the fast assessment without compromising safety.
Yes, so it's really about, the timeliness of when you're sharing information, when industry is sharing information in real time, so you're able to follow the product, as it is developed. And we saw this during the COVID-19 pandemic. It's reassuring to know that really speed does not come at the expense of safety because of the way regulators are managing that.
Mm.
Now, trust is the currency of public health, and without it, even the most effective interventions can struggle to reach those who need them the most. How important is confidence that people have in regulators, in influencing acceptance of innovative products such as this one?
God. Lenias, it's a brilliant point, and particularly in the current climate, trust couldn't be more critical. And so I think, particularly when we're talking about EUM for all products, I think the fact that we engage with the WHO, the WHO is incredibly well trusted, and many countries, um, both in low middle income settings and high income settings, we look to WHO for leadership and trust. So for us, that is critical that they are closely associated and involved. The other part is, we had regulators from, if we just think about Africa, we had regulators from Kenya, Nigeria, South Africa, Uganda, Zambia, and Zimbabwe in our
Mm.
assessments. So that
Yes.
meant that they could see what we were doing. They
Mm.
could not just see, but they could contribute and be part of our assessment. That means
Mm.
that when we come to the conclusion, and they then take that conclusion home, they can trust the science, but they take their own decisions. And I think it's this wider sense of doing this work in collaboration with all the partners. That's
Mm.
one of the things that's critical.
Mm.
The other point, um, I think, is about the EMA commitment to transparency.
Yes.
So we quite actively encourage companies to share our assessment reports with other
Mm.
regulators around the world. Um, and so we they need to redact for protection of personal data, of course,
Mm.
but um, we encourage, and that also is part of us being able to encourage trust and confidence in our assessment, is we have no problems with opening our assessments up to other regulators and for them to
Yes.
say, this is what we did. You take your own decision, but
Mm.
we are being perfectly open and perfectly transparent with you. So it's about creating a collaborative environment. It's about being open. It's
Mm.
about establishing a reputation as being trustworthy, and we are committed to doing that.
Those are really important elements, and I wonder if you could elaborate a little bit more on how it works in practice. You mentioned how your process actually had the participation of regulators from Zimbabwe, South Africa, and others. Talk to us about how it works in practice to allow African regulators to benefit from the European Medicines Agency's science whilst retaining ownership of the decisions that come out of it.
So I'll try not to get too technical details,
Mm.
um, but let's start off right from the very beginning. So
Mm.
we have before a company even comes to us with an application for medicine, we will encourage them to come to for scientific advice. And so that's about how do they design the clinical trials, how do they design the development process. So all the way from there, we will involve um, countries, for example, where the clinical trials are going to be held.
Mm.
So we will ask them to bring their expertise in the disease and the epidemiology of the disease in that
Mm.
setting. We
Yes.
will ask them to bring their own expertise. We share our assessments with them. And just to break that down a little, perhaps,
Mm.
in the assessment of a medicine, we will have, we have big committees. And, doing anything by committee is always complicated. But we have
Yes.
one person who is represented, who is asked to be the rapporteur, so the lead assessor, and a
Yes.
second person as the co-rapporteur, so the second.
Mm.
And they will go away and do their own assessments. So it's not everybody doing all the work, it's just two teams doing the work.
Yes.
And then at some point they will come together
Mm.
with a joint assessment. And that's the point where you go, well, we agree on this, this, and this, but I have a question on that, and you have a question on this. And,
Hmm.
and so we then try to work out through
Yes.
the peer discussion of, so what are the real issues in this product? Part of that process, we will ask the regulators from the other countries to actually be part of that. And
Mm.
we will ask them for their advice. We give them the
Mm.
opportunities to input into our questions in the whole
Yes.
process of developing the assessment. So it's I want to say it's co-created,
Mm.
but that's perhaps but I think you get the ideas. They are part of the process.
Yes.
So and the standards, the process, the procedures, it's identical. It doesn't matter if the
Mm.
product is going to be used in the European Union or whether it's going
Mm.
to be used elsewhere. We use
Yes.
the same committee, the same experts, the same. Everything is the same apart from that last bit that I spoke about at the beginning.
Yes.
Um, then we talked about safety, and I wanted before I sort of finish, um, the pharmacovigilance and post-approval safety is something
Mm.
we continue to look at.
Yes.
So again, when we design, we will design a sometimes a risk management plan, or at least
Mm.
a plan, a pharmacovigilance plan, an obligation
Mm.
for the company, and the regulators who are working with us on this, and the WHO, they'll be part of that design. So there are
Yes.
always commitments in terms
Yes.
of follow up, and is the product as good and as safe when it's actually being used by the intended population. So we're looking for those sorts of data.
Mm.
And
Mm.
we also, the obligation has the pharmacovigilance, and that we work very closely with WHO. That's
Yeah.
a really
So
long question answer to a simple question. I'm sorry.
yes, yes. No, but I get that. It's a collaborative, not top-down oversight process. And I think that's a critical nuance. And that balance seems quite important for sustainable regulatory development in, the countries that are benefiting with this. And what I like about this is that it seems to be really anchored and guided by the disease experts, also coming from the countries. And I think that's really, really important. Now, let's talk about capacity limitations, which can be a challenge. How do these impact regulators' ability to rely on the M4O process reviews?
In terms of their regulatory capacity,
Mm.
it's the way I've described it so far. It seems if everybody's contributing all the time and it's very dynamic. We
Mm.
do know that some regulators who join, they sometimes is not necessarily to actually actively contribute and be part of the science. In
Mm.
some cases, it can be to observe, and it's part of a capacity building process. It's about learning how it can be done.
Yes.
We don't like saying this is the only way to do it.
Yeah.
I often say the European system is it's a model, it's not a template, and so
Yes.
it's an example of how we do it. So for us, it is very much part of a capacity building exercise as well. We we also do know that for some regulators, they are content to rely on our science. They know the
Mm.
reputation, so they are content to receive the assessment report, look at it, and then take their own decision. Uh,
Mm.
and we have the European Medicines Agency is probably, I wouldn't say if not the leading, but certainly one of the leading um, reliance partners uh,
Mm.
that regulators not just on the African continent, but if you look across Latin and South America and Southeast
Yes.
Asia, the Middle East,
Mm.
we can see that many regulators are relying on our scientific output. And it
Yes.
comes back to exactly what you said earlier. It's about
Mm.
trust, it's about reputation, and
Mm.
about our transparency.
I think that's quite powerful. I mean, so in this case, let's look ahead. We to the African Medicines Agency. Do you
Mm.
see that having a role to play in the EU Medicines for All reliance approach in the future?
I am I'm going to put words in her mouth, but I'm pretty sure that Dr. Darko, Dr. Delise Mimi Darko, the new Director
Mm.
General of ARMA, if you asked her that question, she would say her ambition is that ARMA is the agency that will take these do these assessments and take these decisions for the continent of Africa. Ultimately, if we no longer need the EUM for all procedure because ARMA can do it herself, there will be no one more happy than me. So we're actually working. You mentioned ARMA, so I'm currently leading a program, a project at the European Medicines Agency to help operationalize the African Medicines
Yes.
Agency,
Hmm.
to help operationalize the technical scientific committees, and also work with the regional economic communities and the national agencies. Um, we co-funded and co-sponsored the first continental joint assessment of medicines in Africa, and the continental also the inspections that went behind it. And it was the first decision I took, the first funding decision I took. It was
Mm.
and it's it's worked. It's been amazing. Uh,
Mm.
well, I think we now have 12 products that have gone through continental assessments at the level of the entire African continent. There are
Yes.
12 products that are listed for approval, and we're already seeing these being translated into national marketing authorizations. Um, it's only 12 now, but we've shown it can be done, and it's really really exciting. For many, I've been involved with the work around the African Agency for at least a decade, and we always used to talk about it as something that will happen in the future.
Mm.
Now we talk about it because it's now, it's real, it exists. We have a
Yes.
DP, we have the beginning of the secretariat.
Mm.
It's good. We know where it's going to be located, and it's such an exciting prospect.
I agree. It's really quite exciting for us too, especially for us at Medicines for Africa, because we think the bottom line why anybody, all of you and our regulatory leaders do this, it's about protecting and safeguarding patient safety. So it's very exciting to see how the African regulatory ecosystem is growing with global support like that, that is that you're providing with processes like the EUM for all and all the other work you just explained. Now, before we move on, it's important to note that in many countries across the continent, you mentioned this earlier, pharmacovigilance and so forth, but across Africa and beyond as well, pharmacovigilance and post-marketing surveillance systems are really still underdeveloped, which makes it quite challenging to track safety signals and ensure product quality and maintain confidence after the medicine gets to the market. And with that in mind, can you just briefly talk to us whether the EU M4All also includes collaboration on safety monitoring, pharmacovigilance, and post-marketing surveillance?
Yes, so it's not just the scientific decision, the scientific assessment of whether products can be used. We will also ask the companies involved there are commitments to provide pharmacovigilance and safety data globally. So they
Yes.
are required to submit them to us and also into the WHO system. So we will continue to monitor those, and as will the WHO. But so that it's not a launch and leave. It's
Mm.
we will there is a post-marketing commitment on companies that they're required to inform us.
Mm.
On the broader question, it's a very well made point, and but I know already that there are plans to transition the AU3S, which is the smart safety surveillance
Mhm.
program that was launched under the African Union, and there are plans to transition this into ARMA, and I think the central coordinating role of ARMA is not just about the approval of medicines, it's also about how does she have that role to
Mm.
coordinate the network of the national agencies who can all feed in their data,
Mm.
and then we can build up a better idea in terms of at a continental level, what are the safety signals we're seeing in different parts of the continent? Are there particular regions and pockets? And so I think there are some very smart things going on.
Yes.
And so it's we are working to support the pharmacovigilance committee that's going to be set up under ARMA, and and work with some of the regional economic communities and some of the member states.
That sounds really critical. The support is critical, and it's important because safety doesn't stop at approval. It's an ongoing process that you have to keep looking to see if anything turns up. And now, finally, let's look at the future. How do you see the EU Medicines for All evolving over the next decade, for instance?
One of the recent innovations has been instead of treating the EU M4 products and the European approved products as separate, we're increasingly seeing a trend to having joint applications. So the lenacapavir is a very good example. So the company applied for PrEP in the European Union and PrEP for use outside of the European Union.
Yes.
So we're seeing more and more this alignment and convergence. I think this is quite healthy because it's not about seeing different. It's not like seeing the European Union as one, and products for Europe and products for elsewhere. I've always been quite resistant to this idea. I think it's quite encouraging that companies are increasingly coming together. So that's one element of the EU for All. Companies are getting more confidence. They can see it's an easy way to, it's an automatic way to get products into the pre-qualification system of WHO. That's and more use will boost the pre-qualification by WHO. Ultimately, if I'm to be absolutely honest, perhaps a bit radical, if the EU M4 program just stops one day because we have ARMA, because we have improved regional cooperation and alignment in Latin South America and in Southeast Asia, if we don't need the process anymore because other parts of the world have their mechanisms, I would be so happy with that. I would be fine with that. But we're not there yet. Yes. And I think there is continue to be a role. If we look at the 55 countries of the African Union, only 9 of them have a regulator that operates at what the WHO would deem to be an acceptable level of maturity.
Yes.
9 out of 55. It's not good enough. It's fantastic that we've accelerated from 0 to 9 in just a short period of time.
Yes.
But we're going to need to continue to have support from regulators like the EMA, from WHO, and many other regulators who are joined in this until we can actually build that capacity for ARMA to be able to take our own decisions, to take our own assessments for the public health in Africa.
Absolutely. I completely agree. The regulatory ecosystem is developing, but we are not where we need to be. There is a lot of work ahead, and that's what makes the work that the European Medicines Agency is doing with the African Medicines Agency to really catalyze that development, that maturation. That's why it's so exciting, because for us, looking at our communities, what really worries us is the high prevalence of substandard, falsified medical products. And so the only way to get on top of that is to do this work and get our regulators where they need to be. And so I think, your vision is an inspiring one for regulatory collaboration between Europe and Africa to really accelerate that development and that oversight over the markets to make sure that safe products are reaching patients, and of course over the approval of medicines of significant public health impact, as you have just explained, to ensure that they're reaching patients outside of Europe, on our continent, and elsewhere faster. So that is an inspiring vision.
Couldn't have put it better myself.
Martin, Harvey, thank you so much for sharing your insights with us.
My pleasure, Lenias. Thank you for having me.